Hi there, welcome back. For those of you who are joining for the first time, I am Hasid Thanki, the founder of presentation series called Intro to Individual Life Underwriting. Let's review rheumatoid arthritis today. Rheumatoid arthritis is a chronic autoimmune disease that causes inflammation and deformity of the joints. Other problems throughout the body, like systemic problems, may also develop, including inflammation of blood vessels, vasculitis, the development of bumps called rheumatoid nodules in various parts of the body, lung disease, blood disorders, and last but not least, the weakening of the bones, or you call it osteoporosis. RA, rheumatoid arthritis, RA exists all over the world and affects men and women of all races. Especially here in the United States, almost about 2 million plus people suffer from the disease. Women are 3 times more likely than men to have RA. About 80% of the people who are diagnosed with RA are generally diagnosed between the ages of 35 to 50. Interesting data, lots of research and publications out there. Let's talk about the causes and the symptoms. Unfortunately, the etiology of RA is unknown. There are few theories like virus or bacteria or fungus, not or never proven, and there is ongoing research that is taking place. Another contributing factor believed to be genetically inherited, multiple family members. If that is the case, then you may end up having RA. Last but not least, environmental factors does play a role in RA. RA can begin very gradually or it may strike quickly. It starts with the first symptoms are pain, swelling, and stiffness in the joints. The most commonly involved joints include hands, feet, wrists, elbows, and ankles, although other joints may also be involved. The joints are affected in a symmetrical fashion. So this means that if the right wrist is involved, then the left wrist is also involved. Patients frequently experience painful joint stiffness when they first get up in the morning, lasting for at least an hour. Over the time, the joints become deformed. The joints may be difficult to straighten, and affected fingers and toes may be permanently bent. The hands and feet may curve outward in an abnormal way. Many patients also notice increased fatigue, loss of appetite, weight loss, and sometimes fever. Rheumatoid nodules are bumps that appear under the skin around the joints and on the top of the arms and legs. Now, these nodules can also occur in the tissue covering the outside of the lungs and the lining of the chest cavity or pleura, and in the tissue covering the brain and spinal cord. So pay attention, it's not just that rheumatoid arthritis is no big deal. No, it is a big deal. It can have such impact. It can reach out to your brain, your lungs, your heart, everywhere. Now, this lung involvement may cause shortness of breath and is seen more in men, something to make a note of. Vasculitis or the inflammation of the blood vessels may interfere with the blood circulation. This can result in irritated pits like ulcers in the skin, tissue death, gangrene, that's the medical term for that, and interference with nerve functioning that causes what we call numbness and tingling. A note of juvenile rheumatoid arthritis. That is also out there, and there are statistics that suggest that it is estimated to affect as many as 250,000 children just only here in the United States. And by juvenile, the definition is of 16 years up to less than 16 years old. The obvious question comes that what about the diagnosis? And as we said before, and we know now that the etiology is unknown, so there is not just one set of criteria, but the general consensus is this, that there are 4 out of 7 criteria needs to be present, and especially the first 4 for a minimum of 6 weeks. And of course, before we get into that, it goes without saying that the physicians or the doctor would look into the history, the physical examination, the lab, and the radiological findings. And with that correlation, these are the criteria that we need to look into. So as I said, 4 out of 7. So I'll spell those criteria out. First and foremost, morning stiffness for at least 1 hour. Second, arthritis of 3 or more of the following joints at the same time: right or left hip, MCP, wrist, elbow, knee, ankle, and MTP joints. Third, arthritis of hand joints, wrist, MCP, or pit joint. Fourth, symmetric involvement of joints. Fifth, presence of rheumatoid nodules. Sixth, positive serum rheumatoid factor. Last but not least, seventh, radiographic erosions or osteopenia or the bone loss localized to or adjacent to the involved joint. Fair enough about the diagnosis. Now let's take a look at the treatment. Now, whether we talk about aspirin or Motrin or Celebrex to methotrexate or Humira to high-dose corticosteroids or alternative therapies like acupressure or acupuncture or vitamins or yoga, all these are part of the treatment, but what are the factors that the doctors would look into and the patients would provide the feedback? So it boils down to patient's assessment of symptoms, physician's assessment of symptoms, pain is perceived by the patient, disability, and the acute phase reactants. So those are the factors that doctor would look into after getting the feedback from the patient, and then they will decide the right course of treatment for the patients. Obviously, with any impairment, the question comes about where do we stand as far as the prognosis goes. So we can have mild, moderate, severe conditions, but what you may want to make a note of is this, that there are certain factors believed to be, if present, which translates to worse prognosis, and they are, or they include, race and gender. So female, Caucasian, that's number 1. Then number 2, more than 20 joints involved. Then the next is extremely high ESR. Then the next is extremely high levels of rheumatoid factor, consistent lasting inflammation, evidence of erosion of bone, joint, or cartilage on X-rays, poverty, older age at diagnosis, rheumatoid nodules, other coexisting diseases, and there are certain genetic characteristics diagnosable through testing. So these are the factors believed to be bringing worse prognosis. So let's talk about the prevention. Unfortunately, we cannot prevent the development of rheumatoid arthritis, but let's hope that with all the treatment that we were just looking at, the different options, that may slow the progress of rheumatoid arthritis. That is what it boils down to. So watch for the extra articular manifestations in the medical records that you review while underwriting RA, and pay attention to the occupation to correlate, and more so while underwriting the elderly lives, because it could mean extra mortality relatively and statistically speaking. Overall, how do we underwrite RA? As we know, to underwrite means to correlate. So correlate all these details, follow the life underwriting manual that your company expects you to follow, plus the company specifics that may modify, that may allow you to be somewhat aggressive and or be more conservative depending upon your claims, feedback, experience, plus your own actuarials providing ongoing research and data. That is what underwriting is all about. Lot of literature out there, and I try to compile from different resources so that I can, given you are entering this life underwriting career, so I wanted to provide the gist of, this is a quick overview of RA. So lots of literature out there, my friends. If you want to read, please do so, and feel free to contact me anytime. Let's stop here as far as RA goes. We will review when we meet next. We will review blood pressure and build, and we'll take it from there. So all of you, take care. Bye now.